Uh, Sir,
Yes.
now the time is 3 o'clock. With your permission, can I start this webinar, please?
Yes. Start,
Thank you.
please.
Thank you. Uh, I request all the panelists to be joined, and we are expecting to join few more like Dr. Hemant Bhargav and Dr. Mayur Vinaykumar is also likely to be joining. Let me take a privilege to start the formal starting of this program with the permission of the director. I am Dr. Muhammad Alimuddin Khamri, the organizing secretary of this webinar on yoga and Unani medicine. In view of the 7th International Day of Yoga celebration, we are going to celebrate. On my behalf and behalf of the Institute and the whole Unani fraternity, we welcome all of you, the panelists, and the people who are joining from the YouTube live channel. With these few words, I request our director, Professor Abdul Wadud sir, to invite our guests and the delegates who are part of this program to your welcome address, and also request you to give a brief description and objectives of the institute. Thank you, sir. It's over to our director, Professor Abdul Wadud.
Thank you, Dr. Kumri, Professor Alimuddin Kumri. uh, Respected Dr. Raghavendra Rao, Director CCRYN, New Delhi. Respected Dr. Shri Yogi Devraj, Founder, Swami Vivekanand Health Trust, Bangalore. Respected Dr. Hemant Bhargav, Department of Integrative Medicine, Nimhans, Bangalore. And respected Dr. Mayur Vinay Kumar, Yogic Neurosurgeon, Nimhans, Bangalore. All the participants and other my faculty members who have joined this webinar. A very good afternoon to all of you. As all of you are aware that National Institute of Unani Medicine, Bangalore is an autonomous organization under the Ministry of Ayush, Government of India. Its main objectives are to promote education, research and patient care through Unani medicine. This institute has been established in 2004, and since then it is providing teaching in 10 in 10 departments at PG level, and we are also offering PhD in 2 departments, that is pharmacology and medicine. We hope in future we will also open the way for PhD courses in more of the departments of this institute. Respected speakers and participants, International Yoga Day is celebrated worldwide, and probably this is 7th International Yoga Day, I think. And this year, International Yoga Day, known as IYD 2021, is celebrated worldwide on 21st June, and Ministry of Ayush is also gearing up to celebrate it on a grand scale. In the run-up, all the constituents of Ayush are making effort to demonstrate the information, to disseminate the information regarding International Yoga Day 21 in the best possible perspective and good manner. Liam is being a part of Ministry of Ayush is also conducting a webinar today along with the other programs which we are conducting since 1 week. So today is this webinar is being organized. Further, there is a great chance to look into the influence yoga has made into the various disciplines of medicine. Almost all systems of medicine in India and also in abroad are influenced by yoga, whether it is Unani medicine, Ayurvedic medicine, Siddha medicine, homeopathy, or even conventional medicine, all have been influenced by yoga. In a matter of fact, yoga as inspired by great sage, sages who they were they practiced yoga as a physical medium to reach the spirituality. But presently, we are retrospectively observing it to see the effect of this great endeavor on the body system and make it a viable sense for human body, viable science for human body. Sorry. The influence of yoga on Indian culture is far deeper than we perceive. It is not only as a spiritual medium, but also a way of life to be free from stress and anxiety. Its influence on other people who have their ideological roots other than Vedic culture uh, are also feeling very much influenced by yoga, which is clear from their quest for different way of meditations. Almost all cultures have a way of meditation, but yoga is a pure science and it is an art also. It is a science also. So almost on all meditation culture, yoga has a great influence. So I think organizing webinars on this very auspicious occasion of International Yoga Day, I hope this webinar uh, will uh, uh, will enlighten us for the same purpose as had been mentioned earlier by me. Thank you. Thank you, Dr.
Thank you very much. Thank you for enlightening the objective of the institution and bringing some of the important and crucial points about yoga. Let me take a privilege to invite today's guest of honor, the guest genius, and the very pivotal speaker of this today's webinar, Dr. Raghavendra Rauji, who is presently working as the Director, Central Council for Research in Yoga and Nature Cure. Basically, he completed his PhD from Swami Vivekananda Yoga Anusandhana Sansthan. He started his career and he has been associated as a senior scientist in the clinical research and head complement in alternative medicine program at Medicare Global Enterprise Limited. And Sir has completed several research projects. Among them, some of the few are the projects on the rheumatoid arthritis, pre-diabetic studies, cardiovascular disease prevention, where he used both yoga and naturopathy intervention. He has written many international research publications and books, and particularly chapters on the yoga and its application. I'm very happy to place that he is also the member of the Ministry of Ayush, that Unani Yoga Siddha Homeopathy, for writing research protocols. He also won several awards in the field of Ayurveda and yoga. I'm very happy to invite today's keynote speaker, Dr. Raghavendra sir, who is hailing from Bangalore. We are very fortunate to have some work with him also. In the past, I still remember when we had the 9th Info conference, we were there. With this brief introduction, I request my mentor in this regard with this yoga, Raghavendra sir, Director CCRN, please deliver your keynote address.
Thank you, sir. Respected Director Dr. Abdul Wajooj and Dr. Mohammed, fellow panelists, Dr. Yogi Javraj, Dr. Hemant Bhargav, Dr. Mayur V. Kaku, and others. It's a pleasure to be here on this occasion of IDY celebrations. And what better than to talk about yoga and to spread the message of yoga among the masses. Today's event by all the research councils, so I've been attending one after the other today. So we just had one in the morning by the CCRUM. So we have now at NIUM. So we've been having a large number of events today at various research councils and different aspects of Ayush. It is heartening to see that everybody is trying to do something for yoga. They are trying to adopt yoga, trying to spread the message of yoga. So let me just share my views about my work in the area of cancer. And I think this is important because it tells you how you can integrate yoga into conventional mainstream. Hope you can see my presentation.
Yes, sir. Visible, sir. Proceed, sir. Yeah.
Thank you. So I'm just going to share my views and thoughts on how we integrate yoga into oncology. And this is the same principle which we can be followed for other Ayush systems of medicine as well. So let me just go ahead with the particular thing. And if you see today PubMed on evidence for yoga and cancer, you find about 587 research articles on PubMed alone. 50% of these focus on quality of life and symptom management in cancer patients. And many of these, about 50 current trials are ongoing now, which are registered under clinicaltrials.gov. Okay, so this being the case, there is a lot of impetus for using yoga in cancer. This was not so in 1998 when I forayed into research at SVIASA University in Bangalore. I had to go to Kidwai, I had to go to Bangalore Institute of Oncology, and everybody was dismissive about using yoga for cancer. I would like to use yoga for back pain or for hypertension or for heart problems or for stress, but certainly not for cancer. But what has happened today here is it has completely turned on the tide in the last 2 decades. The maximum amount of research evidence for yoga now comes from cancer itself, because this is one kind of population where the disease is chronic, has to be managed for life, and these people are having too much of psychological distress and they have too much of symptomatology, and that is where yoga plays a very, very important and pivotal role in cancer. Okay, once again. So if you look at various Western countries, in various major medical teaching hospitals and universities, especially at UCSF, where I did my postdoc fellowship there for about 2 years, and we saw that there was a yoga department in almost all the hospitals: Mayo Clinic, Harvard, Dana-Farber Cancer Institute, Memorial Sloan Kettering Cancer Center, Banner Health Foundation, MD Anderson. So wherever you go, there is an integrative medicine department. There are yoga therapists there. They train patients in yoga. They teach patients a lot of yoga techniques to help mitigate their symptoms. And if you look at some of the trials which are happening on oncology field, there are about 121 clinical trials. 20% of those publications you see are coming from clinical trials. It's a very, very good level of evidence you see as far as yoga is concerned in oncology. This is more so in oncology than any other field with respect to yoga in medicine. Okay, so and a lot of recently there's been review articles just come, which has been published in a very reputed journal called Cancer by Susan Danhuer, and show for symptom management in oncology, where it talks about how yoga can be used. What is the recent evidence for using yoga in clinical trials, especially in cancer all the time? And you can see that the graph for the skyscrapers are only rising higher.
Dr. Raghavendra, just a second. Yes. I am not able to see your slides move. I am seeing only the first slide.
1 second, sorry. I think this is a problem with the Google Meet. I have to go with this mode. Now can you see my slide?
Yeah, it's fine. Yeah, it's fine. Yeah.
What's moving?
It's moving.
Yeah, thank you. So I was just coming to this. I just want to tell you that there are a lot of yoga teachers and yoga departments in various medical teaching hospitals in US, and this has given rise to a lot of research on clinical trials on using yoga for cancer, and almost 80% of the clinical trials on cancer comes from US. Okay, and 20% of them really comes from India. Okay, and if you look at evidence for using Ayush therapies under complementary alternative medicine publications, and if you start looking at the PubMed publications on clinical trials, there are very few with respect to Ayush except for that of yoga, and we really have to improve in this particular area. We have to do more and more clinical trials and develop more evidence, robust level 1 and level 2 evidence for integrating our pathies into oncology care. So if you look at yoga here, or 20.61% of the publications in PubMed are from clinical trials. And that's a good sign, because you look at mind-body medicine down below, even it is around 23%. So more or less, yoga comes under the ambit of mind-body medicine therapies and is found to be playing a pivotal role as far as cancer is concerned. And yoga for symptom management in oncology, if you see, I was just talking about the publication by Susan Danhuer in cancer. There's huge impetus for using yoga in symptom management in cancer, and they recommend using yoga in almost all aspects of cancer treatment. I'll come to that later on. So if you see the clinical trials over time, they're only increasing in oncology, And these studies mostly focus on patients undergoing cancer-directed treatment, that is surgery, radiation, and chemotherapy. They also focus on post-treatment remission. They also focused on survivorship, patients with disease who are surviving for a longer time with a metastatic disease, etc. Okay, so when they have a metastatic disease, they are on and off treatment, and that's what is called as combined approaches there. And what yoga has been found to do is to improve quality of life, improve the physical function, and improve psychological and cognitive function as well. And if you see symptomatology in cancer patients, what happens is the moment the patient is diagnosed to have cancer, there's a lot of psychological distress on that. But apart from that, the cancer treatment itself can cause so much of symptom problems. Okay, one is the fatigue, anemia. Anemia is also caused due to cancer per se. So patients with cancer do tend to have low blood counts and low hemoglobin levels. Okay, and apart from that, this is compounded by your cancer-related treatment also. Then you have nausea, emesis because of chemotherapy. You have constipation. You have diarrhea. You have cognitive impairment, and all these ensuing symptoms can cause severe amount of psychological distress in these patients. And when it causes a lot of psychological distress, this can really impact their quality of life. So we did a study to look at how does yoga help in improving, bringing about good symptom control in these patients. How does it change your mood states like anxiety, depression? How does it change your perceived stress? How does it modulate cortisol rhythms? How does it modulate autoimmune responses, anti-inflammatory effects, especially with respect to cytokines and NF-kappa B? And what is the production of yoga with respect to the DNA damage or geotoxic stress caused due to radiation on chemotherapy? So we looked at all these aspects over the last 20 years at HCG, and I'll come to the results very soon. Now, one of the most important questions which most of the patients ask is, we know that yoga is a very good tool for managing stress. Okay, stress, any kind of stress you have, psychological stress is there, yoga helps one to cope with that particular stress very effectively. Now, many of the patients who are asking me this particular question, does stress cause cancer? Okay, most of them, when they come and hear that they have cancer, and when they hear that they have to undergo a mastectomy, they have to undergo a colectomy or any sort of surgical procedure, they get anxious, they get worried, and they get distressed. And they also they have several questions. So they have questions whether stress can cause cancer, whether stress can increase the progression of cancer and whatnot. And I've been facing this for a very long time. So some patients come to me and say, I don't drink, I don't smoke, I have a healthy lifestyle, I have a normal body weight, I'm a vegetarian person, I don't eat too much food, I don't overeat, I'm very careful about how I eat, but still I got cancer. So very important here to understand is, we know that the risk factors for cancer contribute only 40% of all the cancers, which we see here. Remaining 60% are caused due to genetic influences and somatic mutations, which are occurring by chance, and it's your fate that you got cancer. That's what we say sometimes. Okay, so very importantly, we should look at is role of stress on tumor environment. There's a landmark study published in 2006, and this study was done by Memorial Sloan Kettering Cancer Center by Dr. Anis Sood and colleagues. It was his students who did this work. So they took breast cancer cell lines, injected into the foot pad of the mice, and these three groups of mice were there, each of them having 30 of them. And in first group, they gave them electric shocks. Second group, they gave electric shocks with a beta blocker called propranolol, which buffers the effects of stress. And the third group, they did not do anything. Okay, they didn't give any electric shock at all. And they just injected all of these groups with breast cancer cells in the foot pad of the mice. And after a month, they saw that the group which received electric shocks, all the mice died. Okay, and the cancer had already spread to the brain, to the peritoneum, to the liver, to the lungs, everywhere in the mice. Okay, the group which received electric shocks but also received beta blocker, 50% of them survived. Okay, indicating that there is a role for the beta blockers to buffer the effects of stress. And the third one, they found out that those which do not have stress, almost around 20% only died, 80% of them survived. Okay, so they came to a conclusion that stress significantly enhances the progression of cancer by production of new blood vessels. Okay, neoangiogenesis we call them as, production of adequate stroma for the cancer cells to lodge and to grow. Okay, and production of inflammatory cytokines and inflammatory milieu for the cancer cells to again grow. So this is a landmark study which was done in the lab environment. It showed very clearly that cancer cells can thrive very well in stressful conditions. Okay, and the next meta-analysis done during the same time, which also published was to look at depression symptoms and major depression. So they looked at breast cancer patients having major depression or depressive symptoms, and they found that mortality rates were very higher. Okay, and they were much earlier, they died much earlier compared to other patients who never had breast symptoms, they have depressive symptoms or major depression. Now, very important is if it is Unani or Ayurveda, it's yoga, Siddha or homeopathy, whichever pathy we take in Ayush systems of medicine, we really need to find out what are the problem areas in that particular area, and then we have to start do our work on integrating that particular pathy into those particular areas by generating evidence. So this is what we looked at initially, looked at what are the problem areas in oncology to find out what is the role of Ayush. Okay, we looked at complications like oral mucositis because of radiation, chemotherapy-induced nausea, vomiting, which is a significant problem, low blood counts during chemotherapy. We looked at difficult symptoms such as fatigue and anorexia. We don't have any medicines for that, especially with respect to cancer. We looked at morphine-induced constipation, especially in those who have pain, bone pain, etc., who are given morphine tablets or morphine therapy. We looked at xerostomia or dry mouth. We looked at neuropathy following chemotherapy treatments. We looked at bed sores in people who are bedridden, who have spinal meds, etc. Okay. We also looked at quality of life of patients. We also looked at reducing treatment-related side effects. So these are some of the areas or focus group areas which can really give some amount of, these are called as low-hanging fruits, where you can really work on integrating your pathy into cancer care, conventional cancer care. Okay. And we also did a lot of work on harvesting evidence. We did a Cochrane review. When we looked at Cochrane reviews with alternative medical systems, we saw that yoga had 46 Cochrane reviews totally, out of which 8 of them were in oncology, especially cancer. This is a very, very good thing because Cochrane reviews really tell you these are systematic reviews, and they have been giving you a conclusive finding of whether there is a moderate effect or a mild effect or no effect at all, or a very large effect size for particular intervention. So this is a very important aspect of systematic reviews, because you have for studies, you have against studies. So you need to really look at these studies very pragmatically and analytically and analyze them using a proper robust methodology called meta-analysis. So coming to our study, we looked at integrating yoga to see whether it helps in surgery, especially post-operative recovery, such as wound healing, immunity, inflammatory cytokines, anxiety, etc. We want to look at, does yoga help in improving mood, nausea and vomiting during chemotherapy, fatigue as well as stress. We want to look at use of yoga in speech articulation, especially in head and neck cancers, because patients with head and neck cancers receiving radiation to the oral cavity develop oral mucositis, oral thrush. They also have speech articulation problems. We also want to look at effect of yoga in fatigue and myofascial pain as well. And as a supportive care, we want to see how does yoga play a role in pain management, immunity, quality of life, and managing constipation and fatigue. Okay, so this is one of the first studies which was published. This is not the first study. Like it was, the first study was published in yoga and oncology. First study was on anxiolytic effects of yoga in patients undergoing surgery, radiation, chemotherapy. This is a 6-month-long study per patient. Stage 2-3 breast cancer patients undergoing surgery, followed by chemo radiation were chosen. And one group was given yoga intervention throughout. Other group was not given any yoga intervention. And we looked for reduction in anxiety, depression, symptoms, etc. related to various cancer-related treatments. And these have been published in 3 articles. Okay, and what we found was a decrease in anxiety, yoga for decrease in anxiety and depression in cancer patients. But this level of decrease was almost similar across other studies also, which was done in US as well, by Model et al. And colleagues, Alison Model, and by Kavita Chandwani and colleagues. So this showed that our studies are almost equivocal with respect to findings in other studies as well. And then we looked at role of yoga and fatigue. Fatigue is a very, very big significant symptom in cancer patients. Allopathists or conventional practitioners really don't do anything much about fatigue. All they say is try to take rest if you have fatigue. Okay, and there's nothing much succor to offer to these patients. So what we started doing is to look at deep breathing practices, improve oxygenation of tissues, improve the respiratory effort, improve the lung results. Okay, so all these things, and do energy conservation exercises or techniques, and all these things helped in reducing fatigue significantly in this population. So in this patient, it's not just physical fatigue here, they also have mental fatigue. Means they have a very low drive, no interest in activities. They feel they are depressed. they they don't even want to come to the hospital also, even that also happens. So this fatigue can be very significantly impacting their quality of life. And this is now, yoga has become a very important part of the Society for Integrative Oncology guidelines in management of cancer related fatigue, okay, based on all our studies. And stage 2 breast cancer, 3 breast cancer patients undergoing adjuvant radiotherapy, we did a very big study here, and we looked at the role of yoga in managing fatigue in these patients. One group received yoga, other group only radiotherapy. And what we saw was yoga reduced we went to look at the mechanism by which it does reduce fatigue, and what we saw was it improves sleep quality, it improves neuroendocrine immune response in these patients, and especially it reduces the stress hormone called cortisol. So we did salivary cortisol assays 6 a.m., 9 a.m., and 9 p.m. on 3 consecutive days before radiation and after radiation. And we used the pooled mean cortisol in the early morning, and we saw the pooled mean cortisol levels come down significantly in the yoga group compared to controls following intervention. Okay, and this is also been published in a very nice journal called Integrative Cancer Therapies. We want to look at the effects of long-term yoga practice on psychological outcomes. And the same cohort which we started off with the first study, we followed them up for 10 years. And after 10 years also, we saw many of them who were surveying had better mood states, had reduced fatigue, improved sleep and quality of life compared to the counterparts who had not received any form of yoga intervention. Okay. We also looked at mechanism of action of yoga in modulating chemotherapy-induced nausea, vomiting. So all of us know that when you have chemotherapy, you get vomiting, and to suppress vomiting, we give antiemetics, and these antiemetics cause gastroparesis. So we want to look at effect of yoga. We know that by doing small postures such as Bhujangasana, breathing, Pavana Muktasana Kriya, as well as by doing Shitali Shitakari Pranayama, we can easily take care of gastroparesis caused due to the antiemetics, and we can normalize the gastric tone. So we did surface electrogastrogram, we did heart rate variability, and we saw that the domination of gastric motility happened by around third cycle of chemotherapy. And this paper also got the Best Paper Award at American Society for Clinical Oncology in 2013 as well. Okay, so this was compared with the Jacobson's relaxation arm and with a control group as well. So coming to again meta-analysis, our studies have been also quoted in our several meta-analyses where we have shown yoga to reduce psychological distress compared to the normal control interventions. Coming to post-operative outcomes, yoga helps when most of these patients receive mastectomy as a treatment or lumpectomy followed by or breast conservation surgery, and because they have lumpectomy or breast conservation surgery or mastectomy, they undergo a lot of psychological distress because there is a change in the body image. And what we saw is in the earlier study, most of them, hardly some of them received breast conservation, but majority received mastectomy during the time. It was in 1990s, late 1990s, I'm talking about. And we saw that yoga helped in improving the wound healing following surgery, post-surgery. It helped in improving the helped in increasing the NK cell counts or the natural killer cell counts in the yoga group compared to control groups throughout the cycle of surgery, radiation, and chemotherapy. And we also saw how does it do. Probably we want to look at DNA damage and repair mechanisms. We did what is called alkaline gel electrophoresis, called as a comet assay, and we looked at the tail length of the comets. The tail length indicates amount of DNA which is damaged, and we have software which can calculate this DNA damage. Okay, and we saw that in yoga group before and after, significant increase in DNA damage after radiotherapy, and whereas in control group also the same thing, but the damage was decreased in yoga compared to controls. Now yoga has been a part of integrative therapies for oncology is become a fad now in US, and now ASCO, Journal of Clinical Oncology, the reputed journal in oncology with a very high impact factor of 25. Okay, they themselves now are started advocating yoga. They have started advocating the SIO practice guidelines. I am now the co-chair of the study interest group on yoga at Society for Integrative Oncology, and we are developing more guidelines and more therapeutic practices and modules for various types of cancers in different conditions now. And we are hope to do a lot of research on this and build evidence for integrating these modules into actual cancer care. And if you see this, what is important, the role of all these studies are, you need to publish in very good journals and with a very high amount of impact factor. And if you start doing such kind of things, then they eventually get into guidelines. And this you can see here in anticipatory nausea or MSS prevention, yoga is now one of the important aspect of guideline. And I'm happy to see my own paper being quoted as an evidence for this particular guideline. Okay, the three papers are there quoted in this particular guideline, and the first top among them was my paper to look at the role of yoga in managing chemotherapy-induced nausea emesis. And that's where your research should lead to a change in the practice, where you can really integrate your pathies into normal conventional care. And the same thing goes with cancer-related fatigue. We have shown physical-based therapies. We have shown yoga as one of the physical-based therapies. This is based on pioneering work of Dr. Carol Mustian at University of Rochester, as well as those from MD Anderson, and also our work also from India as well. And then we looked at NCCN guidelines for cancer, adult cancer pain. They talk about reducing distress by using mindfulness practices, relaxation training, and ASCO panel, which was there, it was formed in 2017, looked at all these SOA practice guidelines in greater scrutiny. In fact, I had a chance to visit ASCO meetings during that time. We were also part of this panel discussions, and so because this was a different group which published this guideline, so we were asked to review that particular guideline, and I was a part of that particular review committee as well. And what we saw here was meditation, yoga, etc. are found to be very useful and managing anxiety, stress, and mood disorders, improving quality of life, chemotherapy-induced nausea and emesis. And this is what right now the current guidelines tell, that you can use yoga for anxiety, quality of life, mood and depressive symptoms, fatigue, and sleep quality in cancer patients. And there's more to come. We are doing a lot of studies there, and we wanted to do a lot of work on headaches, on neuropathic pain, and anxiety and depression, etc. We already done those things. So there's a lot of level of evidence. We have almost 35 full publications in oncology and yoga, 16 JCO abstracts, one ASCO Merit Award, one ESMO podium presentation, and two USSC workshops. And this is it. And I think we did a lot of work at HCG back then for last 20 years, and to look at integrating yoga into oncology. And we were successful in doing it to some extent. And now we are now I'm there now in CCRN, and we are trying to bring about large multicentric studies across All India Institute of Medical Sciences and leading institute of national importance. So in fact, we have started Center for Mind Body Interventions through Yoga, a department in almost all the AIIMS across the country and postgraduate institutes across the country. In these years to come, we'll have these separate departments doing a lot of work and doing a lot of multicentric studies as well. So we get very good level of evidence, and we'll be able to make our own guidelines as far as yoga is concerned. Okay, and this is going to be important because these are going to be practice-changing guidelines where we can integrate yoga into cancer care. And we also wish the same thing should also happen with other Ayush systems of medicine, Ayurveda, Unani, Siddha, and homeopathy also, to do the same thing in the years to come. So thank you for your patient hearing. And this is my session.
Thank you very much, sir. Thank you, Raghavendra Sati, for the wonderful inaugural address. In fact, you have covered a wonderful contribution made by the yoga, the field of cancer management. Your data evidence is what it's showing, that it is ensuring efficacy. We hope to see you to work integratively with the help of Unani system of medicine also in the future. Because of the paucity of your time, we are not admitting the people for the questions. Whatever such queries there will be escalated to you so that to clarify it. Thank you for joining with this. Let me take my sincere request, if you can stay with us for till the termination of the program, it will be well and good. Sir, I hope that you will be with us. Let me take the privilege to invite my friend, who is an MBBS graduate, to shift to Swami Vivekananda Yoga and Samdara Sansthan to pursue postgraduate program in yoga after PhD in yoga also. So, and he has started his career right now, like Dr. Raghavendra sir has told. Today, most of the institutions have an integrated department of medicines where yoga is an apparent part of the department. Like today, we are going to have the Department of Integrative Medicine and the National Institute of Mental Health and Dr. Hemant Bhargav. Right, as I told you, he is an assistant professor. He did his MBBS, MD, PhD, and now he is the one who is, his area of research is exploring therapeutic utility and neurobiological basis of the practice of philosophy of yoga in mental as well as neurological health care. I'm very happy to place this gentleman as a principal investigator. Two of the biggest projects being sponsored by the Department of Science and Technology. One is the Science and Technology and Yoga Meditation, and another one is the Science and Engineering Research Base. And we hope to see him in a higher, greater heights in future. A very good orator, a highly skillful, technical person, a very dynamic young yoga therapist, Hemant Bhargav. It is over to Hemant Bhargav.
You are unmuted, it seems, because
Hemant, we are unable to listen you. I think, please unmute yourself.
Okay. Thank you very much, and Adab Kamri sir, and my Adab to everyone. It is always a pleasure to connect with sir and then share our views. I remember our interaction when both of us actually went to Dharamshala, the Institute of Sri Dalai Lama, and then there was a common platform where we could discuss how the system of Unani, Ayurveda, Yoga basically focus on the holistic aspect of human health. Sir, are my slides visible, sir?
Yeah, yes, it is visible. You just to share your screen, complete screen, sir. Now the first slide is visible.
Yeah, because if I move it, then it won't move if I share my full screen.
No, it's okay. However, it's now it is visible.
It is visible?
Yeah. Please continue in the same way, please, sir.
Fine.
Thank you. Please.
So in my presentation today, I have just focused on giving you all an overview of the yoga practices. Basically, when you see yoga, which actually evolved, it was considered as a highly spiritual practice, which is covered with a lot of mysticism, and only certain people who isolate themselves from the day-to-day life, they seclude themselves and go into Himalayas. In secret caves only you can practice them. This was there a few decades ago, a few centuries ago, but then in the last 2-3 decades, we have seen that yoga has come out of its mysticism and has taken a journey to move towards a scientific practice now. We see that more than 180 nations practice yoga now, including 47 Islamic nations also have incorporated yoga into their practices. So what is yoga? Here we see that the root word actually comes from the word yuj. Yuj means to connect. Now this connection between mind, body and soul, the body, breath and mind coordination, and the connection of the individual with the nature, this is universal. It does not relate to any particular religion or any particular practice. You can see that it is a technique which connects one man to another, a man to nature. So in this way, yoga evolved and became so popular over the globe. But when we look at what is the definition, how did yoga come from, then this is the definition, which is also, you can see that a definition which says that yoga is something which can help you manage the mind better. Agitation of the mind is common problem of the whole mankind. All of us have emotions. All of us face situations where emotions go out of our control, and then we suffer through stress, anxiety, depression. And it is where that we can use our body, our breath, and mind as a tool to calm down the mind. Therefore, when the definition of yoga came, the 8 limbs of yoga became more popular. The yamas and niyamas aspect of yoga are very similar to the lifestyle that you prescribe even in Unani medicine. So we see that basically we talk about mizaj, we talk about the tabiyat and other aspects of the lifestyle. How should be the air? What kind of water you should drink, and all those things. So these kind of cleanliness, hygiene, and all those factors come in yamas and niyamas. Then comes adopting certain postures of the body. Even we see that in different religions also, people have adopted different postures to establish themselves into their own spiritual practices. In fact, one of the very common pose that is used in yoga is called as a namas pose. So it is a very common, wonderful practice which has shown a lot of health benefits. So therefore, adopting a particular posture for health benefits, performing breathing in a certain way to enhance the oxygenation in your system, to enhance microcirculation to your muscles and tissues, and then using the techniques of the mind, you know, focusing of the mind, defocusing of the mind, withdrawal of the senses, and going within and managing one's own energies. This is all about the technique of yoga. These are the 8 limbs of yoga which were given in the traditional text Patanjali. And then in the last 2 decades, we see that it was tested on the scientific paradigms by researchers all over the world. And then a summary has come up now that different limbs of yoga, how can they be useful? So you see that overall now, if I want to summarize the effects, the biological mechanism of actions of yoga, or how the effects have been produced, you can see that one aspect is that the hypothalamo pituitary adrenal axis. This is the central axis which governs all the neuroendocrine changes in the body, and yoga down regulates it and therefore reduces a hormone which is called as cortisol. Cortisol is considered as a stress hormone, and this is the hormone responsible for causing sugar. It is a hormone responsible for causing heart disease, stroke, and major killers of the mankind today. So yoga reduces that. This hormone is also called as stress hormone because stress increases this hormone. Similarly, it is beyond doubt that the practice of yoga, the mind-body medicine of yoga, has an effect on the neurotransmitters in the brain. It can improve your mood, it can reduce your depression, it can increase GABA, which has a calming effect on the brain and reduces anxiety. BDNF is a chemical, a neurotransmitter, a growth factor which is responsible for forming new neuronal connections in your brain. Now researchers show that regular practitioners of these kind of techniques have a thicker gray matter in their brain as compared to non-practitioners. And we know as we grow in our age, our brains tend to shrink. The cortex becomes thinner, the hippocampus thins out, and that leads to loss of memory, dementia, Alzheimer's, and all those problems. So therefore, a regular practice of yoga may have a protective effect against that. Similarly, anti-inflammatory effects of yoga are there. Lot of wonderful scientific evidences have been shown by Raghavendra Rao sir just before me, and he has demonstrated that yoga actually enhances the activity as well as the count of natural killer cells, which are the cells which can eat up the cancerous cells in our system. So there is a biological basis to these practices. They are just not theoretical. And then there are numerous neuroimaging studies which show that this particular part of our brain known as the neocortex gets activated, and the lower areas of the brain which are associated with emotional distress calm down by performing certain kind of yogic practices. So another aspect of yoga is the balance of the sympathetic and parasympathetic nervous system, and then it produces a calming effect on the involuntary part of our nervous system as well. All these benefits of yoga ultimately translate into reduced depression, reduced anxiety, reduced symptom of social withdrawal, and negative symptoms in people with schizophrenia. People don't socialize much now, so yoga makes them connect better. Similarly, the memory, concentration, confidence, all these also shape up the personality and improve with yoga and the sleep quality. Now, the Patanjali's 8-limbed approach ultimately focuses only on one goal, that is to have a calming of the mind. Whether these are the social codes of conduct, bodily postures, regulation of the breath, withdrawal of the senses and going within, focusing of the mind or defocusing of the mind. The ultimate aim is that a human being should be able to have a calm, relaxed, peaceful mind to take right decisions in his life and to live in harmony with each other and with the nature. Then another aspect of yoga is these three dimensions of the mind. Now, in Unani medicine also the mizaj is given a lot of importance. When we discuss, yoga describes that qualities of the mind as sattvic or rajasic or tamasic. A tamasic mind is a depressed, dull, inactive, insensitive mind. It is a sleepy mind which is not sensitive about others. A rajasic mind is overactive, overambitious, wants to achieve at any cost, cannot tolerate failure. That kind of mind. A sattvic mind is able to use the accelerator and brake. He is able to use the clutch properly to sail through this life, the traffic of this life smoothly. He knows where to apply brake, where to apply accelerator. Anger, frustration, jealousy, depression, anxiety. Nobody is free from them. But then a person who does yoga becomes more aware of these feelings, these emotions, and is able to gain a kind of a mastery where he can use those tools for the welfare of himself and the people around him. And therefore, the yogic texts also prescribe diet for such kind of personalities. They prescribe the practices based on the personality types. So, a cooling, calming pranayama for a rajasic personality, dynamic, fast breathing, kapalabhati, bhastrika, trataka, these kind of practices for a tamasic personality. Left nostril is connected to the moon, right nostril is connected to the sun, and it is proven through scientific research that if you do only right nostril breathing, your sympathetic, the activating, alerting part of your nervous system becomes activated. In 15 minutes, there can be a rise of systolic blood pressure by as much as 6 to 8 mm of Hg. Whereas in the same posture, if you just close the right and breathe in from the left, there will be a fall of the systolic and diastolic blood pressure. The diastolic may fall lesser by 2 mm Hg. The systolic can fall again by 6 to 8 mm of Hg in 15 minutes. So these are the biological changes that are happening, and that makes some sense that probably these tools will be able to alter our biological responses, the way our nervous system deals with stress, and probably enhance our resilience to the stressful situations in life. Many people, ऐसे बहुत सारे लोग हमारे पास आते हैं, कहते हैं कि सर योगा करने से और कोई चेंज हुआ या नहीं हुआ मुझे पता नहीं, लेकिन एक चीज हुई है, पहले मुझे गुस्सा बहुत आता था, मतलब अभी मैं जिस सिचुएशन से मेरे लाइफ में गुजर रहा हूं, अगर ये सिचुएशन मुझे कुछ सालों पहले मेरे साथ होती तो मैंने तो किसी को मार ही डाला होता, इतना मुझे गुस्सा आया होता। लेकिन आज मेरे लाइफ में इतना स्ट्रेसफुल सिचुएशन आया है, लेकिन मैं उसको शांति से मैं उसे निकाल पा रहा हूं। मुझे लगता है कि योग ने कुछ तो मेरे अंदर बदलाव किया है। तो ऐसे पता नहीं चलता है, लेकिन इस तरीके की प्रैक्टिसेस करने से हमारा जो नर्वस सिस्टम है, हमारी जो सोचने की जो तरीका है हमारा, उसमें धीरे धीरे बदलाव आता है। हमारे अंदर एक तरीके का एक ब्रेक लगता है। कुछ भी करने से पहले आदमी को एक मोमेंट मिलता है, एक पल मिलता है कि वो सोचे यार मैं बराबर कर रहा हूं या नहीं। ये करने से हमारे जीवन में बहुत सारे ऐसे पल आते हैं जब हमें बाद में पछतावा होता है, वो करने की हमें जरूरत नहीं पड़ती। ये खुद मेरे पिताजी भी बहुत गुस्से वाले थे, लेकिन उनको जब से मैंने योग से जोड़ा और उसके बाद में मैंने खुद उनको बदलते हुए देखा कुछ सालों में, तो मुझे लगता है कि ये ऐसी चीज है जिसे पूरी ह्यूमैनिटी को आज जिसकी जरूरत है। हम सब चाहते हैं कि हमारी जो खूबसूरत ये धरती है इसको हम बचाएं, और इसके लिए मुझे लगता है कि बहुत सारे हमारे जो भी साइंटिफिक टेक्निक्स है आयुष के, सबको हमें यूज करना चाहिए, और एक बेस्ट तरीके से हम कैसे उनको एक साथ ला सकते हैं उसके बारे में सोचना चाहिए। योग और एक बात बताता है कि हमारे जो जीवन शैली है, हमारा जो लाइफस्टाइल है, उस लाइफस्टाइल में इवन यूनानी मेडिसिन में भी लाइफस्टाइल के बारे में बहुत जोर दिया जाता है। तो इसमें कहते हैं कि किसी भी चीज का एक्सेस मत करो, ना तो आप बहुत एक्सेस खाओ, ना आप बहुत ज्यादा सो, और आप शरीर का मूवमेंट भी रखो, वॉकिंग करो। तो ये सब चीजें अगर हम बैलेंस में रखेंगे तो वो बैलेंस करने से ये होगा कि हम लोग हमारे जीवन में किसी भी तरीके की बीमारी को हम छुएंगे नहीं, हम आराम से उन मुश्किलों से, मतलब कहते हैं कि योग आपके दुखों को दूर कर देगा, आपके आने वाले तकलीफों को दूर कर देगा, बीमारियों को दूर कर देगा, अगर आप अपने जीवन में किसी भी एक्सट्रीम के तरफ में आप अपनी जिंदगी में ना जाए। तो देखिए ये एक मॉडल आता है, 5 लेयर का मॉडल आता है। ये 5 लेयर का मॉडल ऐसा है कि पहला तो मेरा शरीर, दूसरा है कि हमारे शरीर के जो एनर्जी है। एनर्जी को हम उसको योग की भाषा में हम उसको प्राणमय कोश भी बोल सकते हैं। हम उसको जैसे कि आप अपने उमूरी तबिया बोलते हैं, अखलाक, अखलाक का कॉन्सेप्ट आपके इसमें बहुत अच्छे से आता है। आप दम, बलगम, सफरा और सौदा के बारे में बातें करते हैं। तो ये सब चीजें जो आयुर्वेद में पंचकर्म को लेकर के वो वात, पित्त, कफ की बात करते हैं, मुझे लगता है कि हम सब लोग एक ही तरीके की बातें कर रहे हैं। सब प्रकृति में जो नेचर में आपका जो ब्लड है, बाइल है, येलो बाइल है, ब्लैक बाइल है, उसका भी जो बेस है वो तो जमीन है, पानी है, हवा है और सूरज की गर्मी है। यही सब चीजें हैं जिससे हम सब लोग जिसके बारे में बात कर रहे हैं। तो ये बहुत ही सुंदर तरीके से ये लेयर बताता है कि पहले आपका शरीर आ गया, शरीर के बाद में ये एनर्जी आ गई, हमारे अखलात आ गए, और उसके बाद में मन आ गया, मिजाज आ गया। मिजाज के बाद में हमारी सोचने समझने की ताकत, जो जिसको इंटेलेक्ट बोलते हैं, कि हमें क्या करना है क्या नहीं करना है, उसकी समझ, और जो उसका जो कोर है, हमारे एग्जिस्टेंस का जो कोर है, उसमें कहा गया है कि वो कुछ भी नहीं है, वो बस एक खुशी है, एक आनंद है। तो जब हम हमारे अंदर की खुशी को ढूंढ लेते हैं तो हमारी तबीयत अपने आप अच्छी हो जाती है। इस कॉन्सेप्ट से योग हमारे मन में जो आने वाले विचारों की जो गति है, इतने तेजी से हमारे मन में ख्यालात एक के बाद एक चलते चले जाते हैं, रुकते ही नहीं है। रात में नींद भी नहीं आती, वो चलता ही चला जाता है, वो रिकॉर्डिंग रुकती नहीं है। वो कुछ समय के लिए रुके, हमें कुछ खामोशी में हम कुछ पल बिताएं, हमारे अंदर की खुशी हमें महसूस हो। बस इसके लिए हम इन टेक्निक्स का इस्तेमाल कर रहे हैं। योग में बीमारी के बारे में ऐसा बताते हैं कि दो तरह की बीमारियां हैं। एक बीमारी आती है बाहर से, जो मेरे शरीर पर आती है, जैसे कि कोई इन्फेक्शन हो गया, एक्सीडेंट हो गया, जहर खा लिया, जहर कोई किसी ने काट लिया, सांप ने काट लिया, ये सब बाहर से आने वाली बीमारियां हैं। उसको उन्होंने अनाधिजा कहा, बाहर से आए। दूसरी बात कहते हैं कि जो बीमारी बाहर से नहीं आती है, ऑटोमेटिकली आप समझ लीजिए कि वो बीमारी अंदर से आती है। और अगर अंदर से आती है तो कहां से आती है? मॉडर्न मेडिसिन कहता है कि ज्यादा से ज्यादा अंदर हम जा सकते हैं, हमारे जेनेटिक्स तक और एपिजेनेटिक्स तक। लेकिन योग और यूनानी दोनों भी उसके बियॉन्ड जाते हैं और कहते हैं कि नहीं, बीमारी उससे गहरी जा सकती है आपकी तबीयत में, कि वो आपके अखलात को खराब करने के लिए आपके मिजाज का उसके ऊपर असर पड़ सकता है। तो वैसे योग भी कहता है कि आपके इमोशन का, आपके मन का, उसको, उसके धातु को, उसके वात, पित्त, कफ को बिगाड़ने में असर होता है। तो इस दूसरे प्रकार की बीमारी को कहते हैं आधिज व्याधि, कि जिसकी शुरुआत मेरे मन से होती है, मन से वो मेरी एनर्जी को बिगाड़ती है, अखलात मेरे बिगाड़ देती है, और उसके बाद में वो मेरे शरीर पर आती है। और दूसरी बीमारी है जो बाहर से ही सीधा शरीर पर आती है। ये दो प्रकार की अगर हमने बीमारियों को अगर हमने समझ लिया, तो एक स्टेप फर्दर जाकर के ऐसा कहा जाता है कि जो बीमारी बाहर से आई है उसको बाहर के तरीकों से ठीक किया जा सकता है। इसीलिए मॉडर्न मेडिसिन जो है वो एक्सीडेंट, इंजुरी, इन्फेक्शन में एंटीबायोटिक देता है, सर्जरी करता है, इमरजेंसी में एंटीटॉक्सिन जो है मेडिसिन देता है, और उसको अच्छे से क्योर करता है, क्योंकि पूरा मॉडर्न मेडिसिन का रिसर्च बाहर की दुनिया में हुआ है। तो वो बाहर से आने वाली बीमारियों पे अच्छा काम करता है। लेकिन जो बीमारी मेरे मन से शुरू हो रही है, मतलब ऑटोमेटिकली आप मान लीजिए कि जिसका बाहर कोई कारण ही नहीं दिखता है, वो अंदर से शुरू हो रही है। अंदर कहां से? मेरे मिजाज। तो मेरे अंदर से अगर शुरू हो रही है, इसीलिए आज की हमारी मेजर प्रॉब्लम क्या है? डायबिटीज। डायबिटीज का बाहर कोई आपको, कोई उसका कारण बाहर उसको समझ में नहीं आएगा आपको कि बाहर ऐसा कोई बैक्टीरिया, कोई वायरस है जिससे वो डायबिटीज अंदर आता है। शुगर बोलिए, बीपी का प्रॉब्लम बोलिए, माइग्रेन बोलिए, एपिलेप्सी बोलिए, अस्थमा बोलिए, क्रोनिक लो बैक पेन बोलिए, एपिलेप्सी बोलिए, कैंसर्स बोलिए अलग अलग तरीके के, ये हार्ट डिसीज बोलिए, बाहर कोई तरीका नहीं। जो कुछ है हमारे अंदर है, हमारे जीने के तरीके में है। और ये सब बदलने में मन का, हमारे मिजाज का बहुत इंपॉर्टेंट रोल है। इसलिए मुझे लगता है कि हमारे जो आयुष सिस्टम है, यूनानी सिस्टम, आयुर्वेद, योग, इनका आने वाले समय में बहुत इंपॉर्टेंट रोल पूरी दुनिया में आने वाला है। और ये समय है कि हम एक दूसरे के स्ट्रेंथ को पकड़े, हाथ मिलाएं और सामने उभर कर एक साथ सामने आए। तो इसको देखते हुए जो हमारे जो मॉडल है उसके हिसाब से जो मैंने 5 आपको लेयर दिखाया, इसमें देखिए एलोपैथी सिर्फ फिजिकल पे काम करता है, आयुर्वेदिक हर्ब्स काम कर सकते हैं, योगासन, क्रिया, यूनानी के आपके जो एलिमेंट्स है, अर्कन है, बेसिक एलिमेंट शरीर के, उनको बैलेंस कर सकते हैं। फिर हम प्राणमय कोश सेकंड लेयर पे अखलात देख सकते हैं। होम्योपैथी भी प्राणमय कोश में काम करता है, पंचकर्म भी वहां पे काम करता है, प्राणायाम भी वहां पे काम करता है। मनोमय कोश में योग के रिलैक्सेशन टेक्निक बोलिए, आपकी कुछ इबादत बोलिए, प्रेयर बोलिए, या फिर मिजाज के बारे में बात बोलिए, यूनानी तिप के बारे में बोलिए, काउंसलिंग करिए, मन को शांत करिए, रिलैक्स करिए, खुश रहिए, लाफ्टर योगा कीजिए। ये सब चीजें आप देखिए कि जो मॉडर्न मेडिसिन है वो सिर्फ अन्नमय कोशा के लेवल पे लिमिट हो चुका है। बाकी के हेल्थ के 4 डायमेंशंस हैं जिसको हमारे जो ट्रेडिशनल सिस्टम्स है वो उसको इतना गहराई से देख रहा है। हमेशा से जो जीने के तरीके को कितना वैल्यू दिया गया है, जो कि पूरी तरह से मॉडर्न मेडिसिन में इग्नोर हुआ है। तो ये हमारी स्ट्रेंथ है। प्रिवेंशन में हम लोग बहुत इंपॉर्टेंट रोल प्ले कर सकते हैं। और एंड में मेरा एक ही मैसेज है कि योग एक साइंस है हमारे शरीर को, हमारी सांसों को, हमारे मन को जोड़ने का। और इसको किसी भी रिलीजियस बिलीफ कोई रिक्वायरमेंट नहीं है योग प्रैक्टिस करने के लिए। आपको आपका जो फेथ है, आपकी जिसके ऊपर आपका मन लगता है, जिस पे श्रद्धा लगती है, उसके लिए आपको योग छोड़ने की जरूरत नहीं है। हमारे निम्हांस में इतने आसपास से मुस्लिम भाई बहन आते हैं और आकर के हम भी बहुत सेंसिटिवली उनसे कहते हैं कि आपको मन में ऐसा गिल्ट नहीं होना चाहिए कि मैं योग को क्यों कर रहा हूँ या अल्लाह को बुरा लगेगा। हम उनसे कहते हैं आप ऐसे हाथ मत मिलाइए, आप अपने हाथ ऊपर करके बैठिए, आराम से बैठिए, रिलैक्स करिए। आप ओम मत बोलिए, आप सिर्फ ऐसे करिए, सिर्फ आप उसके वाइब्रेशन को फील कीजिए। हमारा पूरा रिसर्च सिर्फ ये बता रहा है कि इससे कोई फर्क नहीं पड़ता कि आप ओम बोले, आमेन बोले, आमीन बोले, आप अपने मन में उसकी तरंगों को, वाइब्रेशन को आपके ब्रेन में फील कीजिए। अब इस तरीके से अगर हम इसको एक रिलीजन के बाहर निकाल के एक तरीका ले, आप अपने मेडिसिन को स्ट्रांग कीजिए, योग को यूनानी के साथ जोड़िए, अपने हिसाब से आप उसको जोड़िए, जिस तरीके से आप उसको चाहते हैं कि हम उसको आपके भाई बहनों तक पहुंचाए। और उनके जीवन शैली में अभी कितने लोगों को प्रॉब्लम है, ब्लड प्रेशर हो रहा है, वेट बढ़ रहा है, हार्ट अटैक्स आ रहे हैं, कोरोना में कितने लोग मर रहे हैं, बहुत तकलीफ की बात है। इसलिए मेरा आप सबसे ये मेरी प्रार्थना है, मेरा निवेदन है कि हम सब एक साथ आकर के जुड़े। और यूनानी मेडिसिन में भी जो बेस्ट है, मैं चाहता हूं कि यूनानी मेडिसिन के जो बेस्ट है, स्पेशली जो आपके टॉनिक्स है, जिसमें बॉडी को स्ट्रेंथ देने के जो तरीके हैं, और सेक्सुअल डिस्फंक्शन में इतना जबरदस्त काम यूनानी मेडिसिन ने किया है कि हमारे निमांस के भी जो पेशेंट आते हैं जिनको सेक्सुअल डिस्फंक्शन होता है, मैं स्पेशली उनको यूनानी मेडिसिन में उनको रिकमेंड करता हूं। जिनका इम्यूनिटी बहुत वीक हो गया है, उनके लिए यूनानी मेडिसिन के टॉनिक बहुत अच्छे से काम करते हैं। ऐसे मैंने रिजल्ट्स भी देखे हैं। हमारे खुद के डिपार्टमेंट में, योगा के डिपार्टमेंट में, हमारे सीनियर रेसिडेंट है नजला ईमान, जो हमारे साथ में योग की प्रैक्टिसेस को सीखती हैं और सिखाती हैं। तो मैं चाहता हूं कि हम साथ मिलकर के और कुछ रिसर्च करें, यूनानी के साथ योग देते हुए, योग के साथ यूनानी देते हुए क्या रिजल्ट आए, इस तरीके के हम रिजल्ट देखें। पिछले 1 साल से हम कोविड के लिए कुछ सेशंस रन कर रहे हैं, सुबह 7 से 7:30 और 4 से 4:30 आधे घंटे का सेशन है। उसका पूरा फोकस है कि हम हमारी सांसों पे ध्यान दें और हमारे जो लंग्स हैं उनको स्ट्रांग करें, कोरोना से डील करने के लिए मन को शांत करें, इम्यूनिटी को बढ़ाएं। तो ये जूम आईडी है, आप फ्रीली सोमवार से लेकर शुक्रवार तक उसमें लॉगिन कीजिए और हमारे साथ योग कीजिए। ये जो कुछ भी मैंने सीखा है, इसके लिए हमारे जो एक्स डायरेक्टर हैं डॉक्टर गंगाधर, हमारे अभी के जो एचओडी हैं शिवराम बरमपल्ली, ये मेरे मेंटर हैं, मैं उनका बहुत शुक्रगुजार हूं, उन्होंने मुझे इस लायक बनाया। डॉक्टर नागरत्ना और डॉक्टर नागेंद्रा जो स्वामी विवेकानंद योगा यूनिवर्सिटी के हैं, वो मेरे योग गुरु हैं। मैंने जो कुछ भी योग थेरेपी सीखी है उनसे सीखी है। और ये हमारी टीम है जो यहाँ पे काम कर रही है निम्हांस में। मैं फिर से सर का धन्यवाद देना चाहता हूँ कि उन्होंने मुझे ये मौका दिया आप सब लोगों से जुड़ने का, और मुझे बहुत खुशी हुई आप सबसे जुड़ के। कामरी सर, आपका बहुत बहुत थैंक यू।
Thank you. Thank you. Thank you, Hemant Bhargavji. Thank you. You have made a very wonderful job of integrating the concept of yoga and Unani fundamentals. Of course, this is true. Definitely, as you are told that in the future course of the time, we would like to have an integrated work with yourself, and we will work out on this with the direction of the director, sir. And because of the paucity of time, we are not taking much of the things into consideration. Thank you for joining with us, and I request you to stay to the termination of the program. Thank you, Mr. Heyman. Let me take a privilege to invite the next speaker of this session, whom fondly called as a yogic neurosurgeon. He is the one who's having 20 years of experience in yoga for the last 20 years, though he is a man from modern medicine, MBBS, MS, and MCH neurosurgery, who is presently working as head of the department of neurosurgery in Vasavi Hospital, Bangalore. But because of his passion and the practices and the efficacy what he has been provided with the common public, that makes him to be called as the yogic neurosurgeon. He is none other than Dr. Mayur Vinay Kumar Kaku, doctor. And now, because of his dedication and his interest to make the people to be aware of the utilization of this yoga, he is running one YouTube channel, Mayur Kaku, where around 550 plus educational awareness videos are there. I request our August audience to be part of this lecture, and at the end, I'll be sharing you some of the important things. Sir has done a very wonderful job in the field of neurological problems, where Koge has treated many patients with the brain and spine problem, particularly like the Parkinson's disease, stroke, dementia, spondylosis of the neck and the back, sciatica and chronic illnesses, that too without any surgical interventions, only through the principles of yoga and neurosciences. With this, I request Dr. Mayur Vinay Kakuji, the yogic neurosurgeon. It is over to you, sir, for your deliberation for the next 20 minutes, sir. Sir, please unmute yourself, please. Hello, sir. Unmute.
Okay, are you able to hear me now?
Yeah, yes, sir. Now it's right.
Yes, sir. Yeah, and let us see whether you are able to see full screen also. Are you able to see full screen?
Yes, sir. Yeah.
Okay. So, thank you very much. Can you mute yourself? Your voice interference is coming. Yes. Thank you. Thank you very much. Namaste, everybody. Thank you very much for inviting me for this unique webinar on yoga and Unani medicine. When I opened the video, the first comment was that yoga is very similar to the Unani medicine, and definitely I have no doubt about that. And he was speaking about the 6 essentials. So the 6 essentials of Unani medicine are fresh air, hawa-e muhit, food and drink, makul, mashroob. If I am wrong, please correct me. Body movement and repose, harkat va sukune badaniya. Mental movement and repose, harkat va sukune nafsaniya. Sleep and wakefulness, naumva yakza. Retention and evacuation, that is etibas va istafraga. This was like this I saw for the first time, and it was very interesting to note that how yoga and Unani medicine are so similar. Definitely, we all know the importance of fresh air now, thanks to our dear Corona pandemic. It has shown how we can suffer from the lack of fresh air, from the air which is contaminated with virus, from the air which is contaminated with fungus, and what is the importance of circulation of air. Now, I am placed at a very unique place where I have to be with patients and I have to do research also. In addition to that, from the childhood, I have been trained in yoga, and that is why I was practicing yoga. Meanwhile, as I became a neurosurgeon, people were coming to me, and I had some idea that the yogic practices can be used and surgeries of the spine can be avoided. Also, I had some issues regarding the efficacy and translation of research into our public domain. The biggest example of this is here. Clinical Microbiology Reviews, October 2007. Severe acute respiratory syndrome coronavirus as an emerging and re-emerging infection. This was published by the Hong Kong University, and you can see here the presence of a large reservoir of SARS coronavirus-like viruses in horseshoe bats together with the culture of eating exotic mammals in southern China is a time bomb. This paper is available on PubMed. You can go and see it. It is there. Then the next line is the possibility of re-emergence of SARS and other novel viruses from animals or laboratories, and therefore the need for preparedness should not be ignored. It was so clearly told that either it is a possibility from the animals or it is a possibility from laboratories, and we have to be prepared. It was told 13 years back. And like this, there are many articles we know that these are published in well-known journals, very highly indexed journals. All these things are okay. But what is the translation of these researches into public domain? That is where comes the role of continuously educating public. It is very, very important, and government should be taking active interest in the scientific research happening in its own laboratories. So let us come to my lecture will be targeted mostly towards normal public, and I would like to introduce the concept of neuroscience to normal people. It is extremely important that we understand this science. This science will help us to understand yogic science. This science will help us to understand Unani system of medicine also. It will help us to understand our own existence. That is the most important thing. So neuroscience or neurobiology is the scientific study of nervous system. It combines physiology, anatomy, molecular biology, developmental biology, cytology, computer science, and mathematical modeling so that we understand the properties of neurons and neural circuits. You see here, when the nervous system is alone, you can see here what is the fate of it. So we all know that we all have to work together. If a nervous system is telling I am the best system in the body and wants to isolate itself, it does not work. Nervous system is nourished by the respiratory system, by the cardiovascular system. It is getting nourishment through the digestive system. It is keeping itself pure through the help of excretory system. Otherwise, if failure of one system is there, automatically the other system also will fail. That is the importance of unity in diversity. Now, coming to the understanding the biological basis of learning, memory, behavior, perception, and consciousness. That is what is the goal of neuroscience. We have to learn, and to learn how to learn, that is also very, very important. We know we all memorize, but what is the basics? What is the basis behind the memorization? What is the basis of our behavior? How do we perceive things? We all are born with a clean chit, but as we age, as we become older, we learn to perceive things in different manners. Now there is something called as consciousness. Through that only we are all able to understand all these things. What is this consciousness? That is the ultimate challenge of all the biological sciences. And as a neuroscientist, as a neurosurgeon, I do surgeries of brain, where I do surgeries at the cerebral cortex, where gliomas are there. I do deep-seated surgeries also. There also we have some tumors. Recently, I operated a tumor of pineal gland region, which we call it as the vestigial third eye, and that contains very important hormone that is called as melatonin, and that helps us to maintain the day and night cycle. So these are all very important places, and each and every part is extremely important. As we come up, we go down to a very important area that is called as brainstem, and then brainstem contains all the fibers going down and up, and that is why it is extremely important. Any smallest of the damage to the brainstem, which generally leads to coma and sometimes leads to brain death. The example of this is recently our very beloved actor of Kannada film industry, Sanchari Vijay. He expired because of severe head injury, because his brain stopped functioning. Above this level, his brain stopped functioning. That is how they decided for organ donation. Now, coming to the brain when it is neutral. Now, right now we are all attentive. Okay, we are all attentive. We are all looking at the screen, what is happening, what is not happening. So in this attention, these areas of the brain, which are called as anterior cingulate gyrus, dorsolateral prefrontal cortex, and insula and inferior parietal cortex. All these areas are active. When we are in default mode, means we are just enjoying. Some of us, even though we are looking at the screen, might be in the default mode, and our medial prefrontal cortex, posterior singular cortex, and lateral parietal cortex might be there in the active mode. Okay, so now what is the science of learning? This if we learn, we will be able to expand our knowledge very easily and reach to the Anandamaya Kosha of the Panchakosha Viveka, which is mentioned in Taittiriya Upanishad. So what is the science of learning? It includes psychology, how we individuals and we as a group behave. It includes how our brain functions, that is cognitive neurosciences, and it includes teaching of the best practices and assessments and outcomes. So a combination of all these three things is called as science of learning. If cognitive neuroscience and teaching are combined, it is called as educational neuroscience, which is the need of the hour in our schools and colleges. If cognitive neuroscience, that is structure, and our behavior is combined, then it's called as neuropsychology. The pioneering work is going on in Nimhans. I am also alumni of Nimhans. Then teaching and psychology, that is educational psychology. So these combination of things leads to extremely high level of learning is most important. And my professor Sampath, he used to tell that we have to learn till our last breath. If we stop learning, if we fix our thoughts, then we will never be able to progress as a human being. And that is where is the importance of science of learning. Now coming to yoga. Yoga is a Sanskrit word, and we all know that it means to join or balance. What are we joining here? Okay, we are connecting our individual self to the higher self. Now what is higher self? Always we know that many actors, many successful celebrities, successful people, they will tell, when I was young I was like this, and when I am older I have become much more wiser, and I have a lot of wisdom, and I have come a long way, I have refined myself. So it is actually, yoga is nothing but process of refining and creating the best version of ourselves. That is what we understand. And in the definition which is there in the scriptures, it is called as the fusion of Jivatma to Paramatma is called as yoga. Now here, as you can see, this is me who is performing Ekapada Ardha Padma Baddha Raja Kapotasana. Okay. If I tell somebody here who has not practiced yoga, will not be able to do, and it looks only as if it is a physical exercise. However, it is not so. It is a like body posture, but for that I have to switch down my karmendriyas, I have to switch down my ego, I have to utilize my buddhi in a particular manner, and I have to switch down my senses, that is eyes, ears, skin, tongue, and nose, so that I don't get distracted. Through that, I will be able to control my mind, I will be able to sublimate the ego, and then enter into the chitta, that is consciousness. Through that, I will be able to enter into the cosmic consciousness, that is Mahat, Mula Prakriti, and finally Purusha. So I will not go into the details of this, but however, what I want to signify from here is that the yogic practice is not limited to body exercise. It is actually going into the mind, and then it is going into the mother nature, where we find some things which are not understood in laboratories. Now, many people come to me and they ask, "Sir, I have been practicing yoga for 2 weeks and I'm not getting any effect." Now, for them, I give this example. We all have been using mobiles for last many years now, and we have seen this mobile, the smaller one, the Nokia one. All of us started with this mobile, and now we have all latest touchscreen technology. And in that, we see that if I want to put the software, that is iOS or Android system, into the old Nokia mobile, it is not possible. Why it is not possible? Because the hardware is not ready. Same way, if I want to expand the capacity of this mobile, touchscreen mobile, I have to expand the hardware. So it means that body and mind, they have to go together. Because many patients, they come, they tell body is not ready. Why body is not ready? Because mind is not ready. And if mind is ready, sometimes body will not be ready because body has not been used. That is why the importance of practice of yoga or any kind of healthy habit which we need to develop at a very, very young age. And through that, the balance of hardware and software can be brought. So balance of hardware, body and mind needs to be brought while practicing yoga. And yoga provides a long range of practices. It is not just the practice on mat. Yama, Niyam, Asan, Pranayam, Pratyahar, Dharana, Dhyana, Samadhi. These are the Ashta Angas of yoga. Now, what are these things? Yamas are external disciplines. I will talk about that. Niyamas, asanas, pranayamas, and pratyahara means withdrawal of the senses. Dharana. From pratyahara onwards, it becomes more of mind practice. And dharana means holding on to one thought. Dhyana means effortless holding on to one thought. And finally, when we become the thought, when we become the practice, then it becomes a samadhi. So it is not just that samadhi is something which somebody is going to practice or do in a particular posture. Samadhi is our work itself. When we are doing some work and we become that work, we become the complete representation of our work, then it becomes samadhi. Now, coming back to neuroscience, what all these things mean, and as a neurosurgeon, where I find the link to all these things. So this patient, if you see here, this patient is a non-responsive patient. What does it mean? This patient had a head injury, and because of that, this patient was not able to respond as normal people. However, we could study the instructions given to this patient through functional MRIs. Now, what we can do here is when we do functional MRI and we tell that you imagine that you are playing tennis. So, a healthy brain and a non-responsive brain both are activated in the proper same area. Now, we tell that comatose patient, or we tell that patient who is lying down in the bed, we tell you think about walking around the home. And same healthy brain also was told to do that. And same areas are activated. What does it mean? It means that even if a person is normal and a person is abnormal, the thought process is same. And there is something that even thinking activates our particular areas of brain. This is very, very, very important. Why? Because I will give you one example. All of us would have got jerks when we are sleeping. Suddenly, when we are sleeping, we will have a dream, and then suddenly, what will happen? We will develop a jerk and we will wake up as if we were falling down. The dream is over with a jerk, and we will feel that emotion of falling down, and we will have heartbeat increased. We may have some sweating also, and we may have some kind of tremors also because of the fear of fall. But actually, we all were lying down in the bed. So it means that the dream which was happening, it was causing the neurotransmitters getting released. So the neurochemicals were released. However, the action did not happen. At the end, when the neurotransmitters were synchronizing with the thought process, it gave that jerk to the body. So this is extremely important. This plays an important role in understanding the practice of yoga. Now, yama, the very initial form of yoga is practicing of discipline. Ahimsa, satya, asteya, brahmacharya, aparigraha. Now, what are these things? Ahimsa means non-violence. Gandhiji was pioneer in that. Satya also, Satyameva Jayate is the emblem, national emblem of ours. Asteya means non-stealing. Brahmacharya means continence. It does not mean that sexual preservation we are talking about. It is the continence of our wisdom which we are holding. Aparigraha means non-greed. And all these things I will show you that how they affect our regular life. And as Dr. Raghavendra Rao and Dr. Hemant Bhargav, they explained that these are beyond jati, beyond desha, beyond kala, means these are beyond our means classification of human beings as religions or castes, beyond the limits of the nations and beyond the limits of time. It is all time pervading. Okay, that is called as Sarva Bhauma Mahavratam. So it is happening everywhere. Vitarka Bhadane Pratipaksha Bhavanam. Now, when we understand the ulta of all these things, then we will be able to understand that this is important. We all don't like the news of violence, but violence is universal. Each and every country has violence. We all don't like people lying, but we know that lying is universal. We all don't like stealing, but we know that stealing is universal. Stealing happens at multiple levels. We will have a person stealing some food, or we will have a person stealing thousands of crores and running away from the country. We will have people who are doing sexual misconduct in buses, and we will have people who are doing sexual misconduct at organizational level. Hoarding of food, money and property is also universal. It is not, we are not, we cannot deny it. Okay, it is happening in each and every religion, in each and every caste and each and every country. It is happening. Okay, here there is a joke that most slaughtered creature, because whoever tried to awaken the world was killed. We know that the chicken tries to do that. Now, coming to scientific research done on animals, and through that we understand what is happening. This is something called as bullfighting, which happens in Spain, and this is a very interesting. So, as you can understand, that here we saw about bull, correct? So bull is very aggressive, but that scientist Delgado was able to control the emotion of the bull through the radio frequency after implanting the electrodes. This we are doing now in Parkinson's, in various mood disorders also we are doing. That is called as deep brain stimulation. It is a reality in humans also now. Okay, and many good results are there. However, here very important learning curve is that emotions can be changed through the frequency, radio frequency. Now we are all surrounded by a lot of radio frequency, and we all get influenced not only by frequency. See, it is not only the frequency which is mattering, it is our senses. The senses are more obvious. Our eyes, our ears, our nose, our tongue, and our skin, they excite us to do things. For example, violence. We follow some kind of information on the news channels, and then we become violent. And the studies are done in US, in the other countries also they are done, and they systematically understand the criminal nature of the human mind through functional MRIs and through neuropsychological assessments. And here we have to understand very important thing is the human brain contains three levels of brains. That is, one is archicortex, another one is paleocortex, and the final one is neocortex. So the neo is the new one, paleo is the monkey kind of brain, the limbic brain, and the archi is the fish brain. So fish, if you see, fish will be only interested in protecting its life. The limbic brain will be curious brain and will be taking risks, and through that only we evolved into human beings. Okay, so limbic brain is actually like a monkey brain, taking something, putting in the mouth and seeing what it is, and then sometimes getting damaged also because of that. So amygdala is the one who is like taking the brunt of all these things, emotional stress and learning. And this learning gets consolidated in hippocampus, and it creates memory. And through that memory and all these things, we create social interactions, we create our selective attention, we create affect. Suppose somebody does not speak to me nicely, I will memorize it, and I will next time I will be careful in talking to that person or interacting with this function. And there is something called as dorsolateral prefrontal cortex, which helps us in motivation and executive function. So with all these memories and learning and stress and all these things, we motivate ourselves and we try to execute, as if here we are all trying to become less and less violent, less and less means we holding to the truth, more and more holding to the truth, and like that onwards. So ahimsa pratisthayam tat sannido vairatyaga. Now when we are established in ahimsa, non-violence, what happens? Can anybody tell me who is this person? If you do not know, means later on in the chat you can put, he is Prakash Amte, okay, and he has many. These are all orphan animals. He is taking care of orphan animals, the animals which have been killed by the native people in those areas, tribal people in those areas. The native people, the native people kill and eat those animals, and these are the children or the babies of the those killed animals, and he takes care of all these animals. These animals have lost their violent capabilities. These are not drugged animals. You can go and visit this place. This place is near Chandrapur, and you can visit and see the magic over there. And this is the depiction of ahimsa pratisthayam tat sannido vairatyaga. Now coming to the, I will not take much time. The root cause of the problems. The root cause of the problems is stress and our poor diet, our lack of sleep, our poor relationships, our toxic thoughts, our lack of exercise, getting traumatized, genetics, poor digestion, nutritional deficiencies. And through that, we have all the range of problems. And if you see here, yoga and Unani medicine, they try to address the root cause of the problems. I believe that all the ancient medicines were focusing on the root cause of the problems rather than trying to do the patchwork which modern medicine is doing. I will be very frank in telling this. Movie marathon, let us binge with us. Working late, so are we. These are the kinds of advertisements which are being put by various food companies, and through that, if you see, they are spoiling your mind. They're spoiling you to not have a good amount of food, not have good quality of food, and have more and more food. So this is coming into that food and drink aspect of six essentials of Unani, and it comes in yoga. It comes in santosha. Santosha is not only the state of mental like, oh, I am happy with whatever I have. It is about santosha is about our senses also. Okay, and people, they do not understand the intricacies of what is more dangerous. People think cancer, oh, cancer is very dangerous, but heart attack is more dangerous because it does not give you much time. The intervention is emergency. At that time, modern medicine is very, very useful. Yes, in emergency we are very, very useful, but to prevent and to rehabilitate the patient, integrative approach is the best way. Okay, here road traffic accident or cancer, which is more dangerous? Obviously the road traffic accident is more dangerous. Why? Because it does not give you time. Cancer gives you time. After the diagnosis, cancer gives you time to recover, to get treated, but road traffic accident does not give you. Obviously there will be some advanced stages of cancers also which will not give you time. However, if you compare, and in both the cases, these both the things are preventable. How? In that, one more thing was there in Unani medicine, which was about mental movement and mental repose. We don't have mental movement. We don't have that control over ourselves. Brahmacharya is not only control of the sexual desires. Brahmacharya is control of all the desires. So if we don't have control over our addiction, we don't have control over our driving, then we will suffer through road traffic accident or cancer. Now, neuroscience before diagnosis. Now, whenever some diagnosis happens, what happens? We get feared. Oh, I got diabetes. Oh, I got cancer. Oh, I got this, I got that. And people release stress hormones. And that is how damage to the body multiplies. This is just like we see this kind of a ribbon in dark, we will think that it is a snake. It is just like that. When we realize that this body is just one layer of our existence, then we will be able to go beyond that, and we will try to repair it through our prana, through our manomaya kosha, through our vijnanamaya kosha, and through our anandamaya kosha, which is mentioned in Taittiriya Upanishad. And when we become the master, then we will not fear these wild animals. We all cannot go and stand like this correct? But only the person who has mastered these animals, who is the ring master in the circus, same way we have to become the master of our emotions. When we become the master of our emotions, then we will be able to stand and give a nice pose for a beautiful photograph like this. So basically, what is there? We all have desire to be healthy. Ichha Shakti we are all developing through these kind of webinars. We are developing Gnana Shakti, correct? And but problem comes here, Kriya Shakti. We don't have that consistency. The consistency is extremely important, and we get away or we get like flown away with the gnanendriyas, that is our five senses, and we get distracted. So the distraction is the biggest it is the biggest roadblock for our intellect to refine and reach to the super conscious level. Somebody had asked the question also, that can somebody who has achieved super consciousness can come back to the body? Yes, definitely. Super consciousness is a fused state where you can enjoy the body also, you can enjoy the super consciousness also. Coming to this slide is overused by all the yoga and integrative medicine people. So stress definitely leads to release, because the stress will have a memory and it will get into the memory circuit where hypothalamus is also there. So it will release the hormones, and those hormones will lead to impaired immunity. And impaired immunity not only allows infections to happen, immunity is actually taking care of your pre-cancerous cells also. So there is a chance of cancer also to develop. So that is the importance of this beautiful hormonal axis, which is called as hypothalamo pituitary adrenal axis. Okay. Satya pratisthayam kriya phalashrayatvam. What does it mean? That when we are speaking the truth, automatically our vani, vacha siddhi, which is called as that, oh, this person, whatever he speaks becomes the truth. So kriya phala shrayatvam. So that also is studied in neuroscience, truth, lies, and the MRIs. Okay. I will not go into the detail of your this thing, but yes, definitely. How do we feel when somebody lies to us? We don't feel good. So same thing we have to do unto others as we will do to others. We will do to ourselves. Okay. Asteya pratisthayam sarvaratnopasthanam. Asteya means non-stealing. So this is the area where people develop the thoughts of stealing, lateral orbitofrontal cortex. And now you know from where the stealing happens. The brain in this region is responsible for stealing. There are very beautiful studies in US where people have been studied in detail, and they have been treated. I have myself seen a person becoming hypersexual, and a normal person becoming very bad person, because he developed olfactory groove meningioma in that region, and because of that he started stealing, he started doing wrong things. And then when the MRI was done, then we came to know there is olfactory groove meningioma and that needs to be operated. After surgery he became all right. So this is also possible. Brahmacharya pratisthayam virya labha. So here virya is not that virya which we talk about in general. Virya here is vigor, the enthusiasm, the energy level. The energy levels will be high automatically when we decrease the distractions. Now we all know that if a car needs to be working properly, the car engine should be refined. Same is with us. Our mind should be with least amount of thoughts, with least amount of distractions. Okay, so these are the two important pathways which play with our emotions, with our behavior: dopaminergic pathway and serotonin. Two important, not everything. It is one principal aspect. This dopamine is with reward, pleasure, motor function, compulsion, perseveration, and the serotonin is associated with mood, memory, processing, and sleep and cognition. Okay, so here balance of both the things is required. If balance is not there, we will get distracted. Okay. Aparigraha sthairye janma katanta sambodha means here. Aparigraha means non-hoarding. What happened when Corona pandemic came? People started hoarding this toilet paper, sanitizer, mask, this, that, and all. Even in the second wave, we saw oxygen cylinder related stuff, oxygen concentrator related stuff, bed related stuff, and blaming each other and distracting people and false news, this, that, all kinds of nonsense. Here holding is not only physical, holding is with our ego also. We want to hold our ego. Oh, I am this person, I am that person, I am member of parliament, I am this, I am that. this does not work. This does not work when we understand that we are only passing through this process of nature for 60, 70, 80 or 100 years, and everything whatever we have done is going to be like, it will be washed off. Whether we have done good thing or bad thing, it will be washed off. Why don't we create good memories for others? Why don't we create good memories for our next generation? That should be our purpose. And at that time, we will be able to release our ego. That is very, very important. So aparigraha is not only about holding materialistic things, it is about holding our ego also. So finally, thank you very much for listening to this lecture patiently. My YouTube channel is Mayurvi Kaku, Facebook page is Yenri, and I am active practitioner of yoga. I teach yoga and I help people in preventing surgeries also, specifically spine surgeries, and I make them help to recover faster also. I do surgeries on them. Thank you very much.
Thank you, Dr. Mayur Vinay Kumarji. Thank you for the wonderful deliberation, making us to understand how this yoga and the neurosciences are connected together. Because of the time, the shortage of the time, we are unable to extend your speech because the other respectable speaker is waiting, sir. For this, I'll get you back once again. We have the last but not the least, who is the Guruji Yogi Devaraj, sir. I'm very happy to introduce Sarji.
Because he is the one who walked for more than 3,000 kilometers to create awareness
It's become mute.
benefits of interlinking
Dr. Azublaji,
yogic life. This is a wonderful contribution made
it's
by
muted.
Yogi Devraj Sarji.
Sir, you need to unmute yourself, sir.
Yes.
Okay, and sir has done his MSc yoga.
Dr. Azublaji, we are not able to listen.
Kumri Saab, unmute, please.
Is it okay? Is it?
Yeah.
Yeah.
It's okay now.
Yes. Sorry for the inconvenience. I'm very happy to introduce the last but not the least speaker, who is a very respectable personality in the field of yoga, Guruji Yogi Devaraj sir. I'm just placing before the August audience. He is the one who has traveled for more than 300 kilometers from Kanyakumari, Tamil Nadu to New Delhi to create awareness among and awareness as well as the benefits of interlinking the rivers and the yogic life. And he has done a lot of a job. And he is the one who is the founder of the Swami Vivekananda Yoga and Holistic Health Trust since 2005. And he has conducted several national, international conferences and yoga and many more things. Because of the shortage of the time, I request Guruji Sri Yogi Devaraj sir for your deliberation on yoga for health. So it's over to Yoga Devaraj sir.
Thank you, Dr. Azublaji. At the outset, I thank the National Institute of Unani, Bangalore, for giving me this opportunity of speaking about yoga and health in this occasion of 7th International Day of Yoga. Friends, so far, really, even I was very much keen in listening to all the three research scientists in yoga. It was very interesting. Now, I am going to speak not through PowerPoint as it is. So, yoga for health, generally, we mean health means the physical health. But even World Health Organization, given a definition of health, it's not just the body or the physical health, it is mental or emotional, intellectual, social, and also spiritual health. So, as rightly told by the earlier speakers, we are defined as Panchakoshas. That means Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, Vijnanamaya Kosha, and Anandamaya Kosha. Friends, we are here actually in this earth. It's a beautiful earth to be in Anandamaya Kosha always, so that we'll be always happy and healthy. But unfortunately, we always leave most of our time in Annamaya Kosha. That means in the materialistic world. We are most attracted by the world, glamorous things. That is why we spoil our health. Because always this glamour of this world attracts us to be with that, but we are supposed to live in different levels. Like in mind, also we should live, which creates sapna, as per Mandukya Upanishad. That means we should live for something, dream also. Then we have to go to the deep sleep state. We call it as Sushupti, as per Mandukya Upanishad, to be healthy and happy. That is why nowadays health is also depending. Health is depending on deep sleep state, how much we are going to have sleep. One of the major thing, because during that sleep, we get into Anandamaya Kosha. Because during the worldly thing or Jagrita Avastha, we are not able to give rest to our mind. That is why to give rest to our mind, we need to go to Anandamaya Kosha. This is what is expected in yoga, or the lifestyle designed by yoga. But what is happening today is we are creating the problems everywhere. That is how it starts from mind. See, mind always does not decide actually. It keeps always wavering. That is why the decisions are not made easily. We always go to intellectual or Vijnanamaya Kosha, then Manomaya Kosha will be always to do or not to do, to eat or not to eat good things or not. All these things are becoming problem for us. We are not able to decide because our life itself has become very complex. That is why all our 80% of our problems or health issues today are created in our mind. We call it as Adi. Adi means the beginning. So that starts coming down to Pranamaya Kosha. See, Pranamaya Kosha means the breath. Breath should have a rhythmic way of going. But unfortunately, we don't have rhythmic breathing. That is why pranayama is a must to rectify there itself. We have to identify, rectify there itself. Otherwise, it comes down to Annamaya Kosha, the physical body, where we call ill health or disease. This is. From ease, it has become disease. There, we give some name for that disease. Depending upon our weakness in one of the system, it gets established there. Supposing endocrine system is weak, we get it as diabetes. Our cardiovascular system is weak, we get it as blood pressure. So like that, it gets fixed in particular system with a particular name for the disease. Friends, then we need to, again, to come back to the health, we need yoga. Because yoga is diagnostic, preventive, as well as curative. Because that is how it is being used now. See, the diagnosis, it's very easy. If you are not able to take long breath, again the problem now happening in Corona is the same thing. We are not able to breathe as long as possible. We are not able to hold the breath as long as possible. The breath, it is becoming very short. Or we cannot leave or exhale as long as possible. Compared to the group wherever we are working. That is why whenever we are practicing yoga, we tell people, our students, that observe yourself. That is a group awareness. See, like if you chant, it's okay. But many people, what they do is, they can't hold the breath. So they don't have control on our own breath. So that is a problem. That is because of the habits we are having in our life. That is a lifestyle disorders. That is the meaning, psychosomatic disorders. So in that case, yoga is used both on the mind through meditation or even on Vijnanamaya Kosha. That is giving the counseling. That is for corrections in the Vijnanamaya Kosha. Manomaya Kosha through the meditation and the breath, pranayama, and on body, all the physical asanas. That is why yoga is used as integrated approach of yoga therapy. It is worked on all the koshas to come back to health. Friends, I know there is a paucity of time and everything. I need to restrict my speech. I really thank once again so that we can do some programs together to give more knowledge, because in this just webinar we may not be able to give everything about health. Yoga is very vast as ocean. So I thank once again our director, Dr. Rajibullah ji, for giving me this opportunity, and I'm stopping here. Thank you, thank you, thank you so much.
Thank you very much, sir. Thank you for understanding the time paucity. And now it is my responsibility to give you some of the understanding with reference to the yoga and Unani system of medicine. And I'm not going to take much of your time. Most of the things covered by the previous speakers, like Hemant Bhargavji has already explained about the fundamentals of Unani. And moreover, Dr. Mayurji has brought a very wonderful explanation of the Asbab Sitta Zaruriya, the 6 prerequisites which is mandatory for the survival of any individual. I would just like to correlate some of the thing with what I have learned from Unani as well as the Unani, and this is yoga. Yoga and Unani medicine, as you know, yoga, this is the yoga. Like sir has told, this union, the union through which we are interacting, sharing the knowledge. This is also one of the yoga. Basically, this is a spiritual discipline, what we people have.
Which is focusing on bringing the harmony between mind and the body and human body in the nature.
सर आपका माइक म्यूट हो गया.
Sorry for the interruption. And I'm just going to the conclusion remarks, and it's a part of
to give you some of the understanding of Unani medicine and yoga. Almost Hemanji and Dr. Mayur.
Sir, again it is muted, sir. I think with your hand movement, it is getting.
Oh, so then it is okay?
Yes, yes.
Yeah, this is a yoga. The yoga, we together have united and discussing about the understanding Unani and the importance of yoga system of medicine. That what we literally understood with reference to yoga is nothing but it's a union, right? To the best of my understanding, yoga stands for the spiritual discipline, which focuses basically on the harmonization of bringing harmony between mind and the body. And the practice of yoga leads to the union of individual's consciousness with that of the universal consciousness, that what exactly we have understood, and where they are trying to establish the relationship or the harmonization between not only the body and mind, but also man and the nature, right? And talking few more thing about the in toto aim and objective of the yoga is living with the freedom of all walks of life, where the people have to self-realize, to overcome all kinds of suffering leading to the state of liberation and the freedom, that what we called as moksha and kavya valya. That's what. And according to the history and the origin of this yogic science, somewhere it stands with the Adi Yogi Shiva. From there, the Sapta Rishis have taken this subject and spread it into different parts of the world. Particularly in India, we have been learned this science with Agastya, the sage. Okay. After that, Patanjali, the Maharishi Patanjali, he codified some of the sutras of the yoga that is supposed to be some 60, 50 years, thousands years back. Somewhere it's the pre-Vedic era. Around 2700 BC, we will be learn. We have some information about the yogic sutras and its objective. Like that, some ashta, that some 8 principles of the yoga which speaks about Among that eight, Dr. Mayurji has illustrated the neurobiological correlation with some of the yoga things are like a yama, where he explained about the ahimsa, satya, asatya, brahmacharya, and aparigraha. All these things so we have wonderfully understood, and thank you for that. What you have given an elaborate description, sir. The other parts of the yogas are the niyama, where we are understanding about the swacha, santosha, tapasa, the swadhyayana, Ishwara Pranidhana. This all these things are that I have some understanding to correlate and explain you how we are dealing in Unani system of medicine. With reference to the asana, that what we believe is Thiram Sukham Asanam, and the pranayama, where the control over breath is the major objective of the pranayama, and pratyahara, retrieving these sense organs, all the five essential sense organs, that what we call the external senses. The dharana, darsana, dhyana, meditations. Every religion follows different meditation techniques, but here yoga is very specific about the meditations. Similarly, the samadhi and the samayama, the blissfulness, and this bandhas and mudras, which are the gestures of the channels of the flow of energies, are there. More particularly, shatakarma, that is sixth karma, which is dealing with the purification techniques. We have a very good understanding. Similarly, the yukta ahara, finally yukta karma, and many more things are there from the Ayurveda. By understanding here, Unani, like you people know, but Unani system of medicine is a very classical science of medicine for thousands of years. It is being practiced. Of course, in different areas, it is being named differently. In the subcontinent Asia, it is being called as the Unani system of medicine. If you look into the Iran, this is the Iranian Persian system of medicine, which is having a report of some 6,000 years BC also, mean before the Vedic era. They have their own interpretation. But the modern Unani says the father of Unani medicine is the Hippocrates, who were lived somewhere in the 4th and the 5th BC. And the theories, the principles, what we believe, like already you people have told about the Prakriti, the Mizaj, the Akhlaq, Doshas, answers, that is the bhutas. Of course, there is a difference in fundamental understanding, but the overall philosophy is one and same. But I would like to emphasize here the definition, the understanding of health with reference to Unani system of medicine. What we believe is the equilibrium between all the body fluids, that is the akhlaq, in proportionately with the qualitative and the quantitative equilibrium stands for the health. Any imbalance, this equilibrium leads to diseases. There are certain factors which regulate this equilibrium. Among them, which one is the asbab sitta zaruriya, that we called as six prerequisites are essential factors of the human body, which are there throughout the life of the individual, without which no life can be survived. Nobody can alive. Can we live without air? No. Can we live without food and drinks? No. Similarly, can we live without movement and rest? Bodily movement and the psychological rest and movement. Similarly, can we live without sleep and wakefulness? Similarly, and the most importantly, some of the things which are essential to the body need to be retained and to be evacuated. Otherwise, all these imbalances or dysregulation can cause different sort of diseases. That is the reason our science says the modulation of all these six essential prerequisites like air modulation, foods and drinks, physical movement and repose, psychological movement, repose, and sleep and wakefulness, particularly the elimination and excretion. My understanding, if you look at this yoga, the eight important tools of the yoga, this Harkat Sukun Nafsani is going to emphasize about the do's and don'ts of Yama and Niyama. Like what we have learned here, the Yama and that Yama is this Ahimsa, Asatya, Brahmacharya, Aparigraha, Satya, and so the Santosha, Tapasa. These are all some of the things which are intellectually and psychologically being regulated. One has to have the consciousness to control all those things. And if your psychic energies are right, then the person can able to decide about what is right and what is wrong, how he can manage. And niyama, that like how people are told, do's and the don'ts. All these things are being regulated there. Similarly, the dharana and the dhyana, samadhi and samayama is also being regulated by the psychological movements and rest along with the bodily movement and rest. And the most important part is the pranayama, Yukta Karma and the Bandhas or Mudras are totally the body movements. Here we modulate these the threshold. Unani science explains about the thresholds or the limits of this bodily movement. One cannot go beyond the capability of the individual. Otherwise, it can lead to the diseases of loss of continuity that we call as a tafarruq ittisal. It can lead to injury, dysregulation, structural impairments are there. Like Makula to Mashrubat, where our science is paying much attention about the importance of the foods and drinks, where we follow four principles like in some cases, we'll ask the patient to completely refrain the diets and liquids. Sometimes we need to modulate it to be given a moderate dose. Sometimes we have to enhance the diet based upon the requirement. So that's a quantitative considerations of Makula Mashruba there. Your yogic science says one of the component of the yoga is yukta ahara. Try to consume a limited ahara. Like that, there are more similarities. The fundamentals are little bit different based upon certain discrepancies and interpretation, personal interpretations. Different alternative system of medicines that came into an existence. But in toto, my science says that health is defined as it's a physical as well as mental, above all, overall well-being of the individual is the definition of Unani system of medicine with reference to health. Of course, spirituality has not been directly defined in Unani. Spiritual medicine is a separate, which is a parallel to Unani. We have another thing where the concepts of like the tantra, mantra, and all those things are not there. If an individual whose physical health is good, then his mental health also good. Finally, there is a significance, a relationship between all the alternative system of medicine. Our approach is holistic, and finally, we are working for the betterment of the health with more or less similarities and with more or less some of the individualities of the sciences. Thank you for patiently listening with us. I can say thanks to all of you. Now, this is the time to request Dr. Mr. Nandakishore, who is our yoga therapist and the guru here who used to train us for the yoga for his vote of thanks. It's over to Nandakishore.
Namaste to all the dignitaries on behalf of NIM Bangalore. I take the privilege to thank one and all. First of all, I would like to thank our beloved Director, National Institute of Unani Medicine, Professor Abdul Wadud sir, for organizing chairperson of today's event, for initiating such a wonderful webinar on yoga and Unani medicine on this occasion of 7th International Day of Yoga. Without his support, this event would have been not possible in such a short span of time and providing us the required resources. Secondly, I thank Dr. Raghavendra Rao ji, Director, CCRYN, New Delhi. In these busy schedules also, he has accepted our request and actively participated and explained very beautifully the work which is happening in the yoga therapy in cancer.
I think his internet connection is little weak, sir. I think you should take over.
उमेश साहब आप कर दीजिए वोट ऑफ थैंक्स वो
सर
हाँ
नंदकिशोर
इंटरनेट कनेक्शन डिस्टर्ब है
हाँ सर
वो आ जाएंगे तो कर देंगे आप कर दीजिए ऑन बिहाफ ऑफ नंदकिशोर
Okay, sir. Thank you, sir. On behalf of Nandakishore, and I thought it is my responsibility to place a vote of thanks on behalf of this National Institute of Unani Medicine, the director and the complete the team who is behind bringing this successful webinar. We are very much thankful to the director, sir, for his cooperation and considering our request and executing this webinar. Our greetings are due with the Dr. Raghavendra, the director CCRYN, who accepted our invitation and address the keynote address where we presented the work what he has been carried out. Our thanks are due to the senior most very respectable Guruji Dr. Yogi Devarasi, who is with us since morning and is consistent in support of us. Thank you, sir. You have accepted our invitation and we will make this program very successful. Definitely will follow some of your paths in bringing the yoga and integrating the Unani system of medicine. Thank you for joining with us and encouraging ourselves. My thanks are due to Dr. that the yogic neurosurgeon, the very beautifully explained the relationship between this yoga and the neurosciences. Dr. Mayur Vinayakumar Kakuji, you accepted our invitation. You are part of this program. Definitely, we would have an integration of work with you, sir. We will try to find out some time to discuss with you to have the protocols and bringing some work with this. So thank you for accepting and joining and giving wonderful deliberation. My thanks are due to my friend Dr. Hemant Bhargavji. Definitely, you are the spirit for this program because of your companionship and you recommended the people as the speakers to whom we are contacted, and finally we made this program very successful. I'm very much thankful to you, Dr. Hemant. In future also we will take care of all these things whenever the time permits and the things will be able. We'll take your services for bringing such a program. Thank you to you. My thanks are due to all the people, my team, the technical team, who are consistently working for the last 3 days to bringing this webinar successfully. Giving and moreover, the delegates who have taken part in different parts of the state, college, and all Karnataka state, they're consistently working and they're learning. They're asking us some of the questions. Thank you for joining with us. Once again, I'm very much thankful to my director, Professor Abdul Wadudji, and we expect that the same way you are going to extend your support in future course of such a program also, sir. Finally, thank you, and with this, now the session is concluded, sir. Thanks to all of you.
Thank you. Thanks to all. Thank you, Guruji.
Thank you, sir. Thank